What is lumbar lordosis straightening? You may have often seen such a phrase in the description of an X-ray. For example, you had an X-ray taken, and there, let's say, it says, physiological cervical lordosis is straightened. What does this mean? Is it dangerous? And why does this happen? Normally, there are two lordoses, the cervical and the lumbar lordosis. Lordosis is a curvature of the spine with the apex facing forward, like this. This is the cervical lordosis. The lumbar lordosis looks almost the same. Here is the lumbar lordosis, and here is the cervical lordosis. Normally, the spine has this kind of S-shaped form. And between them is the thoracic kyphosis. Kyphosis is also a physiological curve, but in the opposite direction. And the straightening of the cervical lordosis really looks from the outside like this curve just disappears. The neck becomes straight, like a stick. The same thing can happen with the lumbar lordosis. It can straighten out in exactly the same way. And this also looks pretty much like this. Why does this happen in the neck? But if you think logically, what holds the vertebrae relative to each other? It's the muscles that are located around them. The largest muscles are the long extensors of the neck. This is a powerful group of muscles that goes from the occipital bone almost to the fifth or sixth thoracic vertebra. These are several groups of muscles that combine into one powerful group of long neck extensors. And their main antagonist is the group of scalene muscles. They go from the transverse processes of the vertebrae, here are the transverse processes, to the first and second ribs, attaching there. And when the long neck extensors weaken, other muscles take on the entire load, including the scalene muscles. And the scalene muscles, as antagonists of the long neck extensors, begin to shorten. And it is precisely this that causes a change in the position of the vertebrae relative to each other and the straightening of the cervical lordosis. But why does this happen? Why? What could be the reason that the long extensors of the neck stop working? The simplest, well, not the most common, but the simplest reason is when weakness of the muscles themselves develops. This typically occurs due to displacement of the vertebrae in the upper thoracic region, where the long neck extensors attach. But another common reason is weakness of the back muscles, weakness of the lower back muscles. Because there simply aren't the conditions for the long neck extensors, which hold the neck, to work in this way. Weakness of the long extensors occurs, causing the head to fall forward. Why does this happen? Normally, a person should sit like this, and the muscles of the back should hold them. These are the back extensors, the latissimus dorsi, and the rhomboid muscles. But if the back extensors are weak, which include the powerful spinal erector muscle that runs here, the quadratus lumborum, and the lumbar muscle. So, when these muscles are weak, this kind of thing happens. That is, the lower back just collapses backward. A person can't keep their lower back straight while sitting. It just falls back like this. He sits this way because he lacks the strength to hold his back upright. Under these conditions, the neck extensors are unable to function properly. If here they are able to work, if there are conditions for these muscles to function, then with weakness in the lower back muscles. In this way, they simply can't activate. And that's why the short neck extensors have to activate. That means the head will now be held by these short muscles, not by the long ones. And this explains why, for example, a person is bothered by neck pain, and he can get treatment, but without success. This happens when only the neck is treated, just the neck itself hurts. And they focus on treating only the neck muscles between the vertebrae. There, they realign the vertebrae, but don't restore the lower back muscles, which are the root cause of the issue. Why might there be weakness in the back extensors? First of all, due to a misaligned pelvis. When the pelvis shifts forward like this, and this happens due to weakness of the gluteus maximus muscles. It is very common. This, in turn, causes dysfunction of the extensors because their attachment point changes when the pelvis shifts its position. And so, for successful treatment of neck pain, in order to restore the normal curve in the neck, you need to treat not only the neck, and check whether there is a connection, whether some kind of neck imbalance is related to dysfunction of the lower back muscles. What is dangerous about lordosis itself, or rather the absence of lordosis? Because that's where it all begins. That is, when the position of the vertebrae relative to each other changes, their instability occurs. In other words, the vertebrae stop being held by the muscles, the angle changes, and the angles of movement between the vertebrae themselves change. And the worst thing that can happen is exactly this instability. It's not the displacement of one vertebra relative to another, as that can be corrected fairly quickly. You can simply perform a manipulation or mobilization and put the vertebra back in place. The worst thing is instability, when the vertebra wobbles in one joint or, even worse, in two joints simultaneously. And at the same time, injuries to the intervertebral disc occur right away because the vertebra just moves back and forth. And the vertebral artery syndrome develops. But it is precisely in those cases when a person turns their head that dizziness occurs, simply because the vertebra is not fixed relative to the guide and is compressed. And as a result of disc destruction, the development of a hernia. That is, this is exactly why the disappearance of lordosis is dangerous. Because the load on the spine is no longer distributed as it normally is, equally across all the discs, but instead shifts more onto the 5th, 6th, and 7th intervertebral discs. The same thing happens in the lower back, which is why hernias most often appear in the intervertebral discs between the 4th and 5th vertebrae, and between the 5th vertebra and the 1st sacrum, because when the lordosis straightens, all the load shifts onto them, and they simply start to break down. So, when treating the neck, you should always check if there are any other disorders, so that the treatment can be more successful and effective.